Good afternoon. This is live coverage of Governor Mike DeWine's daily update on coronavirus in Ohio. I'm Karen Kessler, State House Bureau Chief for Ohio Public Radio and Television, in the studios of the Ohio Channel at the State House in Columbus. We welcome listeners and viewers from around the state and the country, joining us via Facebook Live or tuning in on public radio and public TV stations, many of which are usually broadcasting children's programs at this time. And we are glad kids, parents, and caregivers are in our audience because there's lots of information coming up on what's happening with the state's response to coronavirus and what everyone can do to help keep everybody safe. So with me is my colleague Andy Chow. You've been up at all the press conferences. We've been doing this for a little while now. The latest numbers, as we're looking at them from the Ohio Department of Health's website, tell me what they are.
Yeah, and unfortunately we have some sad news that's been confirmed that there has been Ohio's first death from COVID-19 here in Ohio. The total number of COVID-19 cases, 169. That spans 28 counties. There are 39 people being hospitalized right now. And again, there is one death. The Governor Mike DeWine, and Director of the Ohio Department of Health, Dr. Amy Acton, said yesterday that they were investigating a possible death. This confirms it. Ohio has its first death of coronavirus.
And yesterday, the commentary was about whether that was a possible death in Maumee, near Toledo. But of course, we don't know until the press conference when she would confirm, if she can, where that death was.
That's right. And I'm just taking a look here right now. And this is just me reading off of the Ohio Department of Health's website. It looks like it's indicated in Lucas County.
So that would be the Maumee area,
yes.
Definitely. 39 hospitalizations, as I can see, 28 counties in Ohio, 28 out of 88 counties. So what the Department of Health Director and DeWine have been saying all along is it's spreading, it's in Ohio, and the testing doesn't necessarily indicate how widespread it is. That we have to assume it's everywhere.
That's right. And the term that Governor DeWine and Dr. Acton have used over and over again is that Ohio is on the surge. If you've seen the graphs, if you've seen all of the charts that say we're trying to flatten that curve, we are on that surge right now. So everything that the public health officials have been warning about, trying to make sure that we maintain social distance, that we stay away from each other, that we wash our hands, we do everything we can now that maybe we can flatten that curve so we can still stay within the resources that we have here in Ohio, so doctors and nurses and medical staff can still be able to treat people and have the resources to do so. Not only ventilators, but what we hear a lot about, personal protective equipment, having the right face masks, having the right gowns to be able to treat people the way they need to be treated.
And yesterday we heard an order issued by the governor on Ohio Medicaid, expanding and relaxing some of the rules on accessing Medicaid, accessing health services, behavioral health services and medical health services via telehealth. Exactly the whole idea of making sure that people aren't necessarily going out to their doctors and to ERs and hospitals and maybe getting some of that care in home, so we can preserve some of these resources that we're going to need as the surge continues.
That's right. And this is just continuing a trend that we've seen for about 2 weeks now. The state is trying to consistently sort of move on its feet to be nimble when it comes to how the state government should be reacting to this. And what Governor Mike DeWine has said over and over again is that they're trying to be as flexible as possible. And that includes eliminating, relaxing the regulations that we see all around the state when it comes to unemployment compensation, when it comes to the sort of loans that people can apply for. And then, yes, for your health. Again, a person's personal health is not going to stop during this crisis. So with COVID-19 set aside, people are already going through all sorts of other personal health dilemmas. People need to be able to deliver that care, provide that service. So removing the regulations on telehealth for Medicaid, the people who get Medicaid, is just another step towards that.
And it was interesting because it's not just having to use fancy video teleconferencing equipment.
Right.
It can be used on landlines and cell phones. And also, you wouldn't necessarily have to have an existing relationship with a healthcare provider. You can start signing up now, and this is for medical health, behavioral health, psychologists, counselors, dietitians, occupational and physical therapists. It's a huge swath of people who can benefit from this, as well as who are on the provider side.
And I think what the message is from Governor Mike DeWine and his administration is that we realize, or they're saying that they realize the kind of services that still need to continue, and really trying to say, we know that you want to get outside. We know that you need to get to the place that where you need to be in order to get the get the treatment that you deserve. but we need you to stay inside. So I think what the state is saying is do whatever you can to stay inside, do whatever you can to stay in your homes and still get the health treatment that you need.
And the other thing that I think a lot of people are waiting on, and the governor's talked about this all week long, the closing of daycares. He has been looking at daycare ratios and how many kids in those daycares are actually the children of healthcare providers who need to be at work. And so what do we expect a move today on daycare closings?
You know, it sounds like it. And again, we don't know exactly what will be announced from day to day, but the governor has made no secret. He has said over and over again he doesn't want things to be a secret, that he wants to sort of forecast what is on the horizon. And yesterday he did talk about a possible announcement for today about daycares. And what we're seeing in other states is that they've been trying to sort of thread the needle and trying to find a way to still allow daycares to close so that kids are basically forced to stay home and not congregate into large groups, but still find some way to provide that service for the people who need it. So if you are a doctor, if you are a nurse, if you're somebody who has to be at a hospital or at some other essential business, can you still get the child care that you need during this time?
And I wonder if we can hear a little bit. One of the things that happened yesterday was Chief Justice Maureen O'Connor came and spoke about what she wants to see happen in the court system. And I want to know if we could hear a little bit about what Maureen O'Connor said about total closing of the courts, and the clerk of courts offices presents an access of justice problem. But she said that courts can be closed to the public for non-essential reasons.
Courts must be open to address emergency and time-sensitive matters. Indiscriminate closure of the courts with no plan for these issues is not an option. Judges across each county must cooperate among themselves to issue orders and establish procedures necessary to continue essential court functions in this rapidly developing situation and in light of the further directives of Governor DeWine and health officials. The need for uniform buy-in and consistency among judges is paramount.
And O'Connor is asking the courts to do some specific things. And Andy, some of the things that she mentioned yesterday, basically limiting face-to-face interactions such as things like lowering bonds for people. What are some of the other things that she talked about? Lowering
bonds for people, maybe allowing people who are in the jail system who are high at risk of getting COVID-19 or being hit hard by COVID-19, allowing those prisoners to go away, to be released basically and be set in some sort of other isolation during this time. And then really another big thing that she's been talking about is temporarily allowing stays for foreclosures and eviction proceedings. This has been a really big thing. There's a lot of people who are sort of on that edge where maybe they lost their job, maybe they don't have income coming in right now because of this crisis. And should they be forced to be evicted during this time? That's something that the Chief Justice of the Supreme Court did mention. She's saying that maybe local courts should allow a stay on eviction proceedings. However, she is still saying that it's important for local courts to have local government control when it comes to these things so they can make their own decisions about it, mentioning issues like domestic violence issues where maybe a court has to remove somebody from their home, still allowing for that possibility.
She also released $4 million in grants for courts to buy video conferencing equipment so that they could do this. You wouldn't have to require people to show up for some of these hearings. But she did say, like you just mentioned, that it really is up to the local courts to make these decisions, that in other states, they have the ability, a colleague of hers would have the ability to order these things. So she says that and I want to hear, if we can hear the sound, she said yesterday that she'll be working on legislation that could come up next week.
This does not go as far as what you were suggesting, that there would be a pronouncement from the Chief Justice that would be binding on all judges. At least that's my interpretation of Rule 14 at this time. When I mentioned that we are looking at legislation, that's exactly what we're looking at, to create legislation that would, under very, very limited and specialized circumstances, such as what we are experiencing here, should there be a need, the opportunity for the Chief Justice to make those type of orders that would be binding on the judiciary.
And this is just one thing that lawmakers are potentially going to have to take up next week. But she did talk about this being really kind of a limited scope here.
Yeah, and I think that's a really interesting and important message to send, and I think that's sort of something that you're going to see over and over again coming from the state government on down, is this idea that, listen, we are in a crisis, we are in a pandemic, and at some point we do sort of need, on a crisis level, a top-down approach. But the DeWine administration has signaled, judicial branch, legislative branch, they have all been signaling that if they do sort of issue some order that seems to have a sweeping control over things, that they're trying to make sure that it's limited, so it's only through this crisis and to not actually carry over into everyday life after hopefully we get through all of this.
I know that's been a concern about the moving of the primary. The governor and the health order that was issued by Dr. Amy Acton specifically talked about this being a danger to people at this time, and we still don't know the resolution of that. The DeWine and Secretary of State Frank LaRose had talked about June 2nd as being a day for in-person voting. The Ohio Democratic Party filed a lawsuit saying all mail-in voting, with the deadline being April 28th, so we're still waiting for resolution on that.
Yeah, we're still waiting, and really the Ohio Democratic Party, when they filed that lawsuit, I think the initial reaction was, oh my goodness, we have the Democrats going after the Republican establishment. But really what Ohio Democratic Party Chair David Pepper said is that he was filing this lawsuit to get the ball rolling, that he was very upfront about, they think that so far everything that going on with COVID-19 has been bipartisan, nonpartisan, and that this lawsuit was just kind of get the ball rolling to have more of a judicial voice in that change, to not just have it floating out there and be vulnerable to a legal attack from somebody who might want to say, hey, no, March 17th, that was it. We're not going to continue this any longer. So it just kind of gets the ball rolling on solidifying a delay to the primary.
Here comes Governor Mike DeWine coming out for the daily press conference.
Good afternoon, everyone. We have now entered a new phase of our battle against the coronavirus. This phase is not unexpected, but it is tragic nonetheless. Yesterday, Ohio had its first death from the coronavirus. And it was someone who both John and I knew very well, liked very much, respected very much. Mark Wagner Sr., prominent attorney in Toledo, someone who had been on the Board of Elections, someone who had been prominent in the Republican Party. Mick was very well respected and so much very liked by everyone who knew him. And so Fran and I, John, Tina, all of us extend to the Wagner family our deepest sympathy. To his wife, Jo, we're so very, very sorry. To his children, Mark and Greg and Paul, Meredith and Jennifer and Nick, who have lost their father-in-law, and to his 7 beloved grandchildren. When we hear about these deaths in other states, as we hear about them in Ohio, many times, most of the times, we will not know that individual. It'll be another number. But I think it's important for us to remember that each time we hear about a new death, that is someone who was loved, someone who lived their life, someone who wanted to live longer, someone who was cherished by the people in their family and in their community. When confronted with the finality of death in our Judeo-Christian tradition, we often turn to the Scripture for comfort. The 23rd Psalm, so often read at funerals, tells us that, yea, though I walk through the valley of the shadow of death, I will fear no evil, for thou art with me. Thy rod and thy staff comfort me. The beginning of the psalm is also well known. The Lord is my shepherd, I shall not want. And so to my fellow Ohioans, for a while it's going to seem like we are in fact living in the valley of death. It will seem like we're living in the valley of that shadow. But we will get through this. We will get through this. The sun will shine again. It will be spring again in this wonderful, beautiful state of Ohio. I want to take a moment, because this is, as I hear about the story of the nursing home in Miami County, and I think of all the first responders who, in time of crisis like this, but also every day, risk their lives. I want to thank them. I want to thank all our first responders. I want to thank everyone in the medical community, everyone who is working, battling to keep people alive, working so very, very hard in preparing for what will be coming in the days and weeks ahead. You're our heroes. We are grateful for everything that you're doing. We're grateful for everyone who is working so very hard as we go through these difficult times to keep Ohio moving, whether it's feeding us, clothing us, making sure that we have the medical care that we need. Thank you. I'm proud of each and every one of you. I'm grateful for what you do. We have a few announcements today. I want to start by thanking the Chief Justice, who was here yesterday, for what she said, directive that she sent out today. And I just would appeal to all our judges, all those involved in our judicial system, to heed the words of the Chief Justice, to do everything that you possibly can not to have gatherings of people at the courthouse. Justice must continue. The Chief has put out, I think, a very, very logical, well-reasoned directive, and I would just ask everyone to please, please follow that for the safety of all our citizens. Let me talk a moment. Ursel was here yesterday and talked a little bit about the Department of Aging. I want to announce a executive order that I am signing today that will go into effect at close of business on Monday. Close of business on Monday. First of all, this affects our senior citizen centers that are really so often the heart of the community and do so much good. As we've talked about often, it is a significant risk for anyone to be in a group setting. That certainly includes our senior citizens. And yet our senior citizen centers provide some very, very, very important support. These centers will close on Monday at close of business, but I am assured that each of our senior citizen centers has taken care to make sure that the congregate feeding program, where the seniors gather there for lunch, that these same seniors will be able to get this food, and that will be delivered to their homes. So I'm grateful for everyone, the volunteers, and everyone who's worked so very hard to make that happen. Other services that can be provided by the senior citizen center can still be provided, and we hope will be provided. Transportation, I know, is so very, very important. I know in many of our local senior citizen centers that I'm familiar with in Greene County, they provide transport for seniors to doctor's appointments and other vitally important things in their life. We would hope that those would be able to continue, and the senior citizens would continue to be helped. The centers would continue to help our seniors by doing that. Let me also talk about another part of that executive order. And again, we talked a little bit about this yesterday, and that is our senior daycare centers. These centers provide very, very important care for some of our seniors who cannot stay at home by themselves, seniors who live generally with family members, and the family members are gone during the day working. And this provides assistance for the seniors and assistance for those family members. Again, our grave concern is about the danger of those seniors being together and the spread of disease, spread of this virus. So these will also be closing on Monday. We have been telling these providers that this day is coming. Ursel assures me that they have made provision for each of our seniors. We wanted to give a few more days now that we're making the final order. Well, it's an order that we've been signaling for some time, but today making that final order, and so we believe that by close of business on Monday, each one of those seniors who is getting service will also be able to continue to get service in a different setting. Throughout this crisis, I have tried to balance the safety of the people of the state of Ohio, but also tried to achieve continuation of essential services, continuation of allowing people, when possible, to continue to make a living, provide for their family, and to keep our economy moving. I'm fully aware that some of our orders have caused people to lose their jobs. I fully understand that. Each one of those orders was thought out, agonized over. I made those decisions because I felt that the evidence was abundantly clear that those decisions would save lives, would protect lives. We are seeing in the news steps that have been taken by other states, Pennsylvania, California, in regard to the closing of additional businesses. We continue to work to find the right balance. Let me just say that I want to thank the businesses in this state that have gone out of their way, that have done everything they could to comply with the best safety precautions, separating people, making sure there's sanitizer everywhere, making sure when that employee comes in, there's a discussion with that employee. How are you feeling? Are you okay? Businesses that have asked the employees to take their own temperature at home, businesses that have the thermometers that can take the temperature as they come in. We have some real heroes out there in the business community who are really, really focusing on that. And so I thank you. What you do, what you're doing every day is saving lives. There's absolutely no doubt about that. Sadly, I also, though, continue to receive and continue to receive more this morning, emails, texts from employees, from people who have observed what's going on in other businesses, about businesses that are not complying, businesses that are recklessly risking the lives of their employees' families, and everyone that those employees and their families come in contact with. This simply must stop. I implore you, please, do what is right. As I continue to balance my responsibility to the people of the state of Ohio, the responsibility, when I took an oath of office, to do the essential thing that government does, which is to protect the people. As I balance that with our attempt to keep this economy moving, let me make it very, very clear that I will err on the side of protecting people. So, no announcement today, but the bad behavior, the reckless behavior must stop. Again, I congratulate all those who are out there who are making a difference every day. The businesses that are mindful of what they need to do to protect their employees. The evidence shows that when businesses do this, when they're very, very aggressive, they can protect their employees. So I would ask, please do that. I continue to balance this. I continue to look at this every single day and make the decisions which I think are best interest of the people of the state of Ohio. But the sanctity of life, the protection of life, is the most important obligation that I have. Let me now ask Dr. Acton to come up and to give her update on what she is seeing around the state of Ohio. Thank you.
Thank you, Governor, and good afternoon, everyone. And I share again my deepest condolences to the Wagoner family. We today have 169 cases, age range onset, illness onset from February 7th to March 18th, age range 1 to 91 years of age, with a median age of 49. 69 females, 100 males, our first death, and 39 hospitalizations. We now have cases documented in 28 counties. And I will say that to the media, I know that you might be hearing stories of potential other deaths, and those investigations are still ongoing. I really want to take a moment to talk about the incredible work that's being done around the nursing home in Miami County, and to the work being done by the local health department, Health Commissioner Ropes, and his colleagues in nearby counties. This is a difficult situation, and I want to speak a bit about our frontline healthcare workers, the folks who work in nursing homes. I can imagine how fearful it is and how afraid families are when you hear of an outbreak where someone you love is. And the people who are doing this work, are going to be exposing themselves to COVID, and they're still coming and still going to work. These are the everyday heroes that we're talking about. I've heard stories, and I've asked for a picture I'm going to post on our website, a beautiful illustration of these folks on the front lines. But these are the folks, sometimes, they're folks I'm hearing that work in nursing homes that are facing some stigma just because people know that they work in a nursing home. And it's the opposite. These folks are following all the rules we've set for them. We need to thank them every second. We need to help them keep doing their job. It's so vitally important, especially in a situation where people are scared, as in this particular location, that we bolster everything, that we drop off more food. I heard a sad story of a bakery delivery that was stopped out of fear, and that's the opposite of what we should be doing. That's not science, that's fear. We need to make those deliveries. We need to deliver that food. We need to encircle that community with all the help we can give them. And so I want to thank everyone out there on the front lines of what is our first, nursing home cluster. I also want to thank the people that are working in my emergency operating center. I visited the emergency operating center yesterday to meet with my team and teams from a number of areas across the state who do the incident command structure to help those on the front lines. One of the hard things about this is we'll have many different things going on around the state at one time. And these are also essential workers who have to come every day, who face, again, the risk of infection spread. They follow all the protocols as they do in business, but they have to keep showing up, just like our hospitals and our nursing homes have to keep coming to work every day. Our people delivering food have to keep coming. We thank you, and we'll do everything we can to support the folks who need to be there, and the rest of us staying home right now is absolutely essential. I think I'll stop there for today. I do want to remind everyone, please keep going for good information. There's so much misinformation out there right now. Coronavirus.ohio.gov, our helpline. We take your calls as quickly as we can. We know with the thought about these deaths, there might be worries you have, and you can reach out if you feel you need to talk to someone. We're not alone. We're physical distancing. We're not social distancing. We're going to reach out to help each other. 833-4-ASK-ODH if you need to talk. Thank you.
Good afternoon. I do want to start by expressing my condolences to the Wagner family. Mick Wagner was a friend. I had appointed him to the Board of Elections when I was Secretary of State. He loved his country, he loved his state, his community, and certainly his family, and he will be missed. To start off, I want to focus on a couple of things that are happening to help the employers and the employees in the state. As you know, the Governor DeWine declared a state of emergency in Ohio. And as a result, that authority has, through that authority, the Department of Insurance is issuing an order requirement for insurers in the state that would allow employers to take care of their employees with a grace period for insurance premiums. The grace period is for all health insurers, and it must provide the option of deferring premium payments interest-free for up to 60 calendar days from the original premium due date. This means that employers can defer their premium payments for health insurance for up to 2 months. We hope that this will give them some relief during this time, and health insurers must allow employers to continue covering employees even if the employee would otherwise become ineligible because of a decrease in the hours that they worked per week. They will be issuing the details of this very soon, sometime within the next few minutes, I hope. Let me also, we've had questions about unemployment and who is eligible. Governor DeWine, along with Governor Inslee of Washington, Governor Dunleavy of Alaska, and Governor Pritzker of Illinois, today sent a letter asking President Trump to immediately unlock existing federal funding in the disaster unemployment account, declaring that would declare a major disaster and make funding available for 1099 or other types of employees who currently are ineligible for unemployment, or to ask Congress to make this funding available critically for the prompt relief that we need for these employees. This is incredibly important that the federal government step in and help us serve these people who are displaced by the circumstances that we confront in the economy as a result of the actions that have been taken to protect our health and safety. On a bit of hopeful news, I know that the governor has really asked the educators of this state to do all they can in this interim time period to help make sure that learning continues in our schools. I was, in the last 24 hours, contacted by Hilliard Superintendent John Marchhausen, who's on our the Governor's Workforce Board, and he explained to me that they are doing great at distance learning in Hilliard, that they have over 16,000 students a day logged in to participate in school. And to be logged in, you have to, or to count as participating, you have to actually log in and do your work. You need to make sure that you're submitting the work that your teachers have asked you to submit. It really is quite stunning, the great work that they have done there. Yesterday, they had over 16,703 students, I guess the number was, logged in. Their average February attendance was 15,575. So not only are the teachers and the administrators in Hilliard embracing this, the teachers are calling the students just to make sure they're getting them involved, but the students and the families are responding even at a higher rate than they did normally in the month preceding. So it's just one case, but I like to highlight the cases to show that it's possible and that our educators and our families are taking their education seriously. Super important, and I know that that other schools around the state are doing this, and all of those educators to be commended, because they had to turn this around quickly. They find out at the end of 1 week, and many of these schools by the beginning or the middle of next week had these services up and running. I want to also add some business best practices. The governor talked about his enormous responsibility to find the balance between the health needs of the people of our state and the economic and business and work needs of the people of our state. And over the last 24 hours, actually 48 hours, we've been in touch with lots of businesses asking for best practices and imploring and frankly demanding that they execute these best practices. And some of these you've heard before, but I will take the liberty for any business person who does not know exactly what we're talking about to hear these once again. Businesses are taking the temperature of their employees if they have that capability at work or before they go into work. They're asking employees to do that at home if they don't have that capacity. They are dedicating people to specifically clean all of the surfaces, door handles, rails, all the things where somebody might touch them. They have adding dedicated personnel to clean those surfaces. They are removing chairs from areas where they're too close together and where people could congregate. They're staggering breaks and lunch areas so that people don't congregate in one location. They are carrying out the 6-foot rule. And I know that one suggestion that we had from a small business that they did, coffee shop, we don't want people, we have carry-out business and delivery business going on at our restaurants. We don't want people congregated tightly in lines. They put pieces of tape down on the floor with the sign that says, every 6 feet, please, respect one another. And that's capable, anybody's capable of doing that who's similarly situated. They've asked employees to stay at home after work and to not travel outside of the workplace. If anyone is exhibiting any symptoms, they immediately send them home. Many businesses have gone to A and B shifts so that they can spread out the number of employees. They might have one group of people work during the day and the other group work in the evening so that they can avoid tight congregations. People have also identified an individual at their particular facility or in a particular part of their facility to be in charge of enforcement of these rules, to own it, to make sure that the rules that they establish are being implemented system-wide. They are making sure that there's available sanitizing supplies for their employees. They are banning any gatherings without personal spacing. We see that here in the State House when there are meetings that go on where you have to spread people out so that they are not close together when you're doing your work. No community gathering space. You may have a coffee maker where people gather, no more. You got to stop that kind of stuff. You can't have people going in to the same location, gathering without it being clean and sanitized. No sharing equipment without it first being disinfected. And obviously the one that Dr. Acton and we all talk about all the time, washing your hands and not touching your face. These are all things employers are doing to make sure that they're acting responsible. But as the governor noted, he and I both get these messages of employers who aren't doing these things. For those of you who are, keep doing it. Keep leading. For those of you who aren't, you are acting irresponsibly and you're putting us all in jeopardy, and it needs to stop. Grocery stores. Have been talking with grocery stores over the last 24 hours. They are all hiring. They are in some cases even offering bonuses for people who are working there and people who will sign on with them. They are essential to our supply chain, and they ask that everybody be patient and cooperative and not treat their employees or other customers with, or don't fail to treat the employees or their customers with respect. We have to respect each other. And that brings me to just a final couple points I want to make. One of these grocery stores told me about literally a fight breaking out between customers over toilet paper. Over toilet paper. Come on, folks. We have to be better than that. We have to be better than that. We got to treat people, got to treat each other better than that. We got to respect people in their workplaces. But I'll also tell you another story of a courageous state employee. This person is vital to keeping the technology behind that unemployment system up and running. Over the course of the last week, they had a loved one in their family, a sibling, who was suffering from cancer, who was on their deathbed, and they chose not to go visit them because they had to keep the system up and running for those tens of thousands, ultimately hundreds of thousands of people who need it. It was a selfless act. I want you to put those two back to back and think about it. Which side of this do you want to be on? Which side of this do you want to be on? How do you want to remember yourself as we went through this? Because tough times reveal our character. They'll reveal us as being selfish or selfless. And that's also true of our society. Think about this in those terms. How do you want to think about yourself on the backside of this when we got out? Do you want to remember yourself as somebody who contributed to the good of our world, to the good of our state, or do you want to be fighting in a grocery store over toilet paper? We're better than that. It's time to lift our spirits to the calling of our better angels, and I know that we're capable of doing that. And so those of you who are, thank you. Inspire others.
Well, as we've said, today is certainly a somber day, and both John and I have pointed out some places where our fellow Ohioans maybe could have done better. But let me just say that what I'm getting every day from people throughout the state of Ohio is that they are doing a good job. They are patriotic. They're doing what they need to do. And so we just appreciate that very much and ask people to continue to do that. Yesterday I talked about likening this to Pearl Harbor when we'd been attacked. And today I would want to read you something I received. I called upon all Ohioans yesterday to fly their flag. I see that a number of you are doing that. Please continue to do that. Those of you who have not, put the flag up We're all in this together. We have been attacked, not by a foreign enemy, but certainly by this god-awful virus. But I woke this morning to an email that had to really make me smile. Let me read it. Mr. DeWine, we do not have an American flag to hang outside our home. Today, after your news conference, my 7-year-old daughter made this flag for our house in honor of your request. So I would like to thank 7-year-old Elena in Radnor, Ohio, for the beautiful flag. Great work. Be happy to respond to questions.
Thank you, Governor. Jim Province with the
Hey, Jim.
Toledo Blade. You mentioned that we've entered a new phase of this crisis. Is the response to the death any different than a suspected infection? We've heard from some first responders that were concerned that they did not hear sooner about this so that they could have been tested.
Okay. We'll let Dr. Acton take that on.
Yes, Jim, the response would be very similar. And the second, it's very important, and I'll say this, to nursing homes, to hospitals, to anyone who is encountering someone who you suspect or is diagnosed with COVID, reach out to your local health department. In hospitals, they have infection control folks. Sometimes people forget those folks exist. The sooner you reach out, the sooner that investigation starts. And as you can see, some things go in a different pace, and I think in this case, it was a little later in notifying. So the second that starts, they get out and start going to every contact. So it's really important that we engage our local health departments in every investigation.
And I know we've been restricting who can get a test. Does that change now that we know that there's been a death?
Yes, you know, when there's a cluster or a death or a person in that sort of situation, we know there are those contacts. They will also be considered. And then they're also taught what to look for. Again, our testing, I'll have more for you tomorrow. I'm talking to all our hospital CEOs a little bit later this afternoon. We're all talking about, you know, the issue on testing has been put down to the states. My emergency operating team is looking at what all we can do. People are inventing things, but right now, first responders, healthcare workers, people at high risk, certainly people associated with a case like this would be the people to go to first. And I just want to say one other thing. It's important to know that most of us will stay home with this virus. We might not even be tested. You hear that called the mild to moderate group, but I don't want people to take that so lightly. When you get this, a lot of people, from what I'm hearing now, and we hear more stories every day, feel pretty awful. It might be up to 2 weeks of feeling awful. So, you know, I don't want to make it lightly. We call that, just because you stay home doesn't mean you don't feel good. And really work with your provider to help you get some symptom relief with that. As we said, it's the 20% that are going to be really pressing in on our healthcare system. And there might be people, even in a nursing home, that stay and convalesce in place, even knowing they have the disease, but they're not needing hospitalized. And similarly, it'll be comfort measures and supportive care. And then you just watch for symptoms that make you think it's more urgent to go to the emergency room.
Thank you.
Hi, Dr. Acton. Molly Martinez, Spectrum News. You said earlier this week that, you know, if you begin to show symptoms and you're otherwise healthy, stay home, just assume you have it. But we've been getting emails from viewers saying that they have been tested and it's been weeks and they still haven't had any results from those tests.
Oh, boy, our laboratory is turning tests around in 24 hours. And I just want to say again to folks out there, even hospitals, we really need to use the ODH lab when possible, because I think some of the companies that people are shipping out to are way behind. They're prioritizing. Remember that there's a lot of prioritization of resources based on the cases states have, or if they're one of those really like hot zones out on the coast right now. And the thing is, here in the Midwest, it's been made light of, but this is everywhere. This community spread is everywhere, and we can't show you a number of cases that we haven't been able to show. So it's really important to take advantage. We have ramped up testing capability. We don't always have the test kits yet, but if that test is done and you want a quick result, get it to the Ohio Department of Health laboratory. And there's information on our website how to do that.
Thank you, and thank you for your work.
Thank you.
Kevin Landers, WBNS 10 TV. Governor, you mentioned about the bad actors and businesses in our community. We are getting a lot of emails at our station specifically regarding call centers. Are those the businesses that you are receiving complaints about as well? And to Dr. Acton, regarding pharmacies, they're among the last standing, and because they're the most easily accessible health professionals, patients are coming in with symptoms and understandable questions, and the pharmacy board is asking for pharmacy benefit managers should immediately cease all audits while the declaration of independence declaration of emergency is in place, so that they can provide easy access to patients without doing audits, and the patients don't have to come in to get their prescriptions, and people feel that may be another concern. Thank you.
As far as the call centers, the complaints I got did include call center, but it certainly was not confined just to call centers. It was a wide range of different types of businesses.
And I'll talk to our partners in pharmacy and look into the kind of policy change you're talking about. A lot of regulations. I told you a long time ago we're going to be breaking rules and making things easier for everyone to do what they need to do. So I'll definitely take that back with me. But also I know there's been some news about medicine, mainly anti-malarials out there, and I've been talking with the pharmacy board in terms of how to handle that and a rush on those drugs to make sure that we don't have that in the state.
Thank you.
Hi, Laura Bischoff, Dayton Daily News. Governor, if businesses continue to act in a reckless manner and they are not abiding, what is your next step? What is your next intervention that you'll put in place?
Well, I think people can imagine what that next step would be. So, you know, I've not hesitated in the past to close businesses and other operations if they are a threat to the public. So the safety of the public has to come first. There's a way we can do this, but we have to do it. So, you know, I think I've demonstrated that, you know, I'm going to put the safety of the people first. And we try to get that sweet spot, we try to balance it, but I'm going to err on the side of protecting people, and that's, you know, people can be assured that, everybody can be assured that my decisions will be based on that.
I had a real quick question for Dr. Acton, just to clarify, if someone gets a negative test on COVID now, it doesn't mean that like a week or two from now they can't get exposed to it and then have it. Okay.
That's right, and early on in an illness, it depends on the viral load, and so sometimes really, really early on, we've heard anecdotes of that not showing positive yet, and of course you can still get it, even though you tested negative one time. And that's why that use of testing it's not something that we would all get. Now surveillance, which we'll hear a lot more about, which is just seeing the level of it in a community, ultimately we will be looking at testing people that are asymptomatic once we have more testing capability.
Thank you.
Hi, Jessie Balmer with the Cincinnati Enquirer. I guess in light of what we know about the importance of physical distancing, can we safely hold an in-person primary this year, and will you be recommending mail only instead to lawmakers?
Well, this is a discussion we obviously have with the General Assembly. We're kind of on two dual tracks at this point. We've got a case in court and we've got a General Assembly coming in. But I think that at a minimum, we would want a significant enough time for people to be able to obtain and return absentee ballots. It's a two-step, as you know, a two-step process. You've got to fill it out. They got to say if they want a Republican ballot, Democrat ballot, independent ballot. They got to ship it in. Then it's got to be sent back. Then they got to fill it in. Then it's going to be sent back. So we don't want to do this overnight. At the same time, we're conducting this when a war is going on. I mean, literally, we're conducting this when we're fighting the virus, and we know that there'll be more and more of our fellow Ohioans who are becoming sick. And so having enough time in there is very important. Whether we can do it, you know, in regard to an in-person election, I don't know. I think the most important thing is that people have ample time to be able to vote.
Governor, this is Ben Garber from ABC6 and Fox 28. The governor of Illinois is expected this afternoon to issue a shelter-in-place order. I'm wondering, what would you need to see in order to consider doing something similar? And also, have you been coordinating with neighboring states, the governors in those states, to make sure there's a more unified response, since some of our border communities, it may be great to have one set of restrictions in Ohio, but if the same is not being done in Indiana or Kentucky or Michigan or Pennsylvania, then maybe those restrictions aren't as effective. Are you coordinating with them?
I talk to governors usually once a day, somebody. Sometimes we're on conference calls. So there is a lot of sharing of information, sharing of ideas. You know, how do you handle this? How do you handle that? So that certainly is going back and forth. I mean, you use the term shelter in place, and that's, you know, we can use maybe other terms as well, but many Ohioans are doing that, and we're asking any Ohioan who can do that to do that. It's the wisest thing to do. It's the safest thing to do, and you know, I would suggest everybody who has the ability to do that. Now, there's certain people who have to be out. Nurses have to be nurses, doctors have to be doctors, first responders have to do what they do, and people who work in nursing homes, people who work in our prisons. But we've asked state government, everybody, all my cabinet members, you know, trim that down. People can work from home. They need to be working from home. Only the essential. We've asked every business to do the same thing. So in a sense, we have that. We just don't have that for everybody. But even if you would issue an order today, if I would issue an order today, you've still got to have a whole list of people you exempt, or we're not going to eat, or we're not going to, you know, be able to continue to function. So sometimes, you know, it's not all black and white. It's not either shelter in place or not shelter in place. We are sheltering in place, and I would take this opportunity one more time to say to anybody, don't travel. You know, if you're coming back from Florida or someplace, stick around home. Don't go anyplace. We don't want that being, whatever it is, you know, we don't want the virus being brought in, and you don't know, and no one knows whether or not you have it. But for everybody else, you know, if you can stay home, you need to stay home, and that's just the wisest thing to do.
Thank you.
Hi, it's Andrew Welsh-Huggins with the Associated Press for Dr. Acton. Why are there, it appears to be significantly more male patients at this point than females? Does that represent a pattern of testing geographically, chronologically? Does it represent some kind of reaction to the governor's orders and your orders to stay away from large crowds by gender somehow?
You know, I've asked myself the same questions, and you know, my team's going back, they're looking at a lot of data from other countries as well. And I saw that same predilection in some of the China data. And I'm very curious to find out, well, you know what, this is not enough data, this is not a sample size that you could really draw any conclusions from. There was some, like, women are following the rules and maybe men, you know, we've had, like, you know, are there other explanations for this? Why would that be? But this is just too little data. You know, it's skewed who are testing and not testing. It's not uniform across the population. So we don't have an answer to that yet. But it's part of the typical demographics that we give, including the age range, which, again, even medians can be very skewed by numbers of cases. But I have to say, we are seeing in this country, and there is some good data that was out in pediatrics and elsewhere about young people getting this and getting sick. So I just want us, teenagers of every age, I've told you the 1 in 250 that die of 40 to 50-year-olds, and we're seeing a lot of younger people getting sick. So I just want everyone to take that seriously, knowing that we'll learn more every day, every hour about this. So thank you for that question, though. I'll be with you when we find the answer.
Yeah. Thanks.
Dr. Acton, Mike Campbell from WHIO-TV in Dayton. At the Washington news conference today, the Vice President said that they were reaching out to states, making it easier for them to get medical supplies from the federal level. I wanted to ask you if that is actually happening, and then also if you can talk about how many masks and ventilators you have on hand versus how many you'd like to see for the need coming down the road.
So I absolutely, and I've been promising folks, we're doing an inventory right now, and it's one of the things I'll be talking to the hospital CEOs and CMOs about in a little bit. So we're going to share the data as we have it. because we're trying to map it across the state. We're also drawing in, as you know, a lot of supplies from the non-essential surgeries that have stopped and other things that are coming in. One of the interesting things the president did that I think might have gone unnoticed is this taking of the construction industry supply, which is fairly large. And I also want to say that a number of major businesses that reside with headquarters in Ohio have said they have access to some supplies. So we are actually creating, a lot of this we're creating for the first time, a whole logistics stream, trying to get a supply chain. This is not part of my normal public health expertise. I've been talking to people who have done this for major corporations. I've been talking to some people who are wanting to help us invent software to track it. But it's going to be an imperfect system. But again, notify your EMA locally if you have supplies. We will definitely take them. We do anticipate severe shortages, so we're taking everything we can get.
Thank you. Hi, Governor. Jeremy Pelzer at Cleveland.com. I wanted to see if you had an update about closing or limiting daycares, and if so, how you determine which should close and which should stay open.
You know, we're not there yet, but as I think I indicated yesterday, a number of the children in daycare have already been taken out. We've encouraged people to do that when people had the ability to do that. So our daycare numbers are down significantly. I'll try to get to you those exact numbers tomorrow. We're basically moving towards a situation where we're going to allow the hospitals to establish their own daycare if they need to do that. Again, it's coming down to only essential, people who are essential. What we want to make sure before we issue the final order to close the other daycare centers is that that child has somewhere to go during the day. So that's coming.
Isaac Dreyer from WHIZ News. Have you or are you considering any interstate travel ban? I know you've suggested that people quarantine themselves when coming back from like spring break or something like that, but have you considered a ban?
Yeah, I'm not a constitutional scholar, but that's basically within the realm of the Congress and the President. You know, we can't put up a barrier on 70 or 71, and we just can't do that. So, but we can certainly encourage people, or, you know, if you're coming back from vacation, you live in Ohio, that's fine. Go home though. Stay home. Don't go around, go out for, you know, because we don't know what you're bringing back. So.
Thank you.
Andy Chow, Ohio Public Radio and Television State House News Bureau. Governor and Dr. Acton and Lieutenant Governor, if you want to touch on this too. For the past couple of weeks now, your administration, journalists, we've all been trying to spread the word that this is something to take very seriously. You have to stay at home. You have to practice social distancing. And like you said, we've already heard cases of people not taking that seriously. But on the flip end, there are people in Ohio who are taking that very seriously, almost maybe panicking. What advice do you have for people to try to balance taking this seriously without freaking out?
Well, I'll start, and this is more in Dr. Acton's realm probably than mine. But, you know, I think that if people do the things that the doctors are telling them to do, they've done everything they can do. And, you know, they should then go on about their life. Now, it may be a little different life, but you know, they'll be reading more books, they'll be watching more Netflix, they'll be, you know, taking walks. Nothing wrong with going outside, taking walks. You know, keep the 6 foot distance. But this is not. We can't panic over this, and because we're going to be doing this for a while. And so, what I would just suggest is that people get into a routine. You know, most of our life is controlled by routine. Well, we got to change our routine. And come up with a routine that makes you happy and that is consistent with how you want to live, but it's also consistent with the rules now that we have to live under to make us, you know, to make us as safe as we can. So I think it's people kind of getting used to it. It takes a little while to get used to it, but find some other joys. I know some people have been emailing Fran about her chicken and noodles, and they've been making noodles. Well, somebody sent her a thing yesterday, so I'm getting ready to make the noodles. And somebody else said, my mom and I were watching you, and we decided, okay, we're going to go cook right now, go in the kitchen and cook. So, you know, people who are already in a house, they're already in a house, they're already living together, they're already together. I mean, people can do things. You know, write a letter. As Dr. Atkins said, the social, you know, we don't want social distancing. You know, look for more opportunities to connect, but just not physically. Doctor?
Well, I just going to grab one thing. First of all, and maybe I've never said this enough.
Your map holder.
Map holder. This curve's going to go down. You know, this curve, we are on the slope now, and that's been the hard thing, at least for me today, is I know we're ramping up to seeing this, and this is the time we want you to take it very seriously. This will last, and we don't know exactly how long, but it won't last forever, and it will pass, and we will have treatments, and maybe even sooner or later, some things that might help us. So I want people to know this isn't forever, but it is shocking, even to me and my family, to change who we are. And it's hard to slow down, you know, and just not be in those routines. And a lot of us have been sort of mindlessly chugging along in our life, and this is just disrupting how we like know ourselves. And that is going to be uncomfortable, but it's not always a bad thing. And even a little stress is not always a bad thing if you can allow it to open you up, maybe to some wonder again. We have lots of tips, though. We know that there are people that are struggling all the time. On our website, coronavirus.ohio.gov, my favorite colleague over in mental health and addiction, Lori Chris, was here once before and gave some great tips, and she's going to be collecting those. I think the folks out there who are starting the what to-do lists, and we've been trying to design some, but I think it should go viral, that helping each other with ideas of what's changing and what's good in our life, or maybe what we're waking up to. I remember September 11th when it happened. This is a longer version of a sort of a waking up in a shock. But I just remember the strange, and for those of you who remember this too, odd sense of everything that has been political or ridiculous in our life just fell away in a moment. And I hope we'll allow that to happen for ourselves, because this is slower. And we can get caught up in worrying about things, but I hope we'll allow that falling away to happen and kind of wake up to something more meaningful.
Governor Eric Halpern with NBC4. Earlier today, the president said the Department of Education is not going to be enforcing standardized testing requirements. Any update on what the state is going to do when it comes to those standardized tests?
Well, I think I've already indicated that, you know, we were not going to have testing if that was going to get into the way of what we're doing. Look, we're looking at, we initially said 3 weeks. We know that's going to be longer. This very well could extend throughout the whole academic year. But as John indicated, you know, we're getting some very good reports back with young people who are learning. My prediction is we're going to, you know, figure out different ways of learning, and the distance learning is going to get perfected maybe better than it has in the past. So, you know, out of every cloud, there's some sunshine, and you know, these kids are going to be okay. And I thank the teachers. Thank you for what they're doing. But we're not going to let testing, you know, we're not going to fixate on testing. If that's not possible, we'll certainly talk to the legislature about it, but if it's not possible to have testing, we're not going to have testing. We're not going to worry about that.
Thank you.
Adrienne Robbins, NBC4, and my question's for Dr. Acton. Obviously, with the news of Ohio's first death today, does this signify a new phase that our state is into you? And at this point on the timeline, should we expect to see that death toll rise now?
Yes, unfortunately, you know, yesterday was a very hard day for me, I'll just admit it, and this morning, because I know we're entering a little bit of a new phase. We knew we'd see these deaths. We've known this will happen, but it's still very hard to take when it happens. And I think we will see more. But I just want to, again, share my condolences to the family that we're all going through this together. Every single life matters, and, we'll be with you through this every step of the way.
Thank you.
Hi, I'm told this is the last question. This is Max Philby with the Columbus Dispatch. Dr. Acton, I checked with some local hospitals today, and it sounds like so far they're not all seeing much of a spike or a surge in cases or patients yet. Can you tell us a little bit about when we might expect to see something like that in Ohio?
That's right. I think, I can't tell you how, again, amazed I am by how the hospitals and others are just stepping forward in unprecedented ways. And so it's going to happen in a community like we're seeing. There's a hospital involved in Miami County that, that's the hospital that's being affected right now, taking in some patients from the nursing home. And it will happen like that. It will be, as I've said before, we won't have one spot in Ohio, but it'll affect each community a little differently in due time. But I assume that it will affect most, if not all, communities at some point to various extents. And that I can't predict how that will unfold, but we know that will happen. And so right now, many of our patients, the numbers I had, I think today of hospitalizations, we know that our hospitals are at 70% capacity. We can still handle that, and hopefully if we keep doing everything right and we slow down, we flatten that curve, that gives our hospitals, our nursing homes, and everyone else the best chance of riding this out comfortably. So it makes a difference, everything we're doing by staying at home.
We look forward to seeing you all tomorrow at 2. Thank you.
And that's Governor Mike DeWine's daily press conference with Ohio Department of Health Director Dr. Amy Acton and Lieutenant Governor John Husted, giving an update on what's happening latest with the coronavirus in Ohio. And as you heard at the very end there will be a briefing tomorrow on Saturday. So continuing on with all the information that DeWine and Husted and Acton have been offering up about what's happening with coronavirus. A couple of things to update here. One of the things that DeWine did in this press conference is he did note that he is going to close down daycare, senior daycare facilities, senior adult daycare, and senior centers at the close of business on Monday. He's been suggesting that that would be something that would be a possibility because of concerns about coronavirus in that particular population. So let's go to the latest numbers that we have on coronavirus in Ohio. And there are 169 cases of coronavirus in Ohio, and that spans 28 counties. The breakdown is a little bit more males than females. And also this time we had our first death. This is a death recorded. Mark Wagner Sr., the father of former State Senator Mark Wagner, who's the chair of the Lucas County Republican Party. The presumption was that he did get diagnosed with COVID-19, the disease that's caused by coronavirus, and that was confirmed today, that he is Ohio's first death, though apparently there are investigations going on in other parts of the state about other possible deaths, and we'll be hearing about that throughout the next couple of days. And as we just heard, we'll be hearing about that tomorrow, Saturday as well. So my colleague Andy Chow is already down here. That's right. Pretty good.
Yeah, I made good time, yeah.
So tell me, what stood out to you in the press conference today?
You know, it's the same common theme that we've been hearing over and over again, this question that he's basically wrestling with or trying to balance when it comes to businesses. And we've been hearing it all around the state that of course, there are many businesses that have been forced to close, restaurants, bars, movie theaters, but there are still many others that remain open. And so there's a lot of people grappling with what they should do, and it appears that the governor is also grappling with that decision too. There's a huge economic impact to making the decision to close non-essential businesses. There's also this huge impact to employees. On one hand, if you consider their health and safety, then obviously allowing them to just stay home is the best thing to do. But this is their livelihoods, this is their income. So telling them that they can't come to work has an impact on that end too. I think it's something that just will remain sort of in the scope of the conversation for days to come. I think it's something that will ultimately happen at some point, unless we hopefully see some sort of dramatic drop in cases and everything. But that's just a big part of the conversation. And I don't know if you caught at the end, but he did talk about daycares. And that, again, that's another thing where if you're going to close daycares, then you probably have to do something when it comes to other businesses, because if you take away somebody's ability to put their kids somewhere so that they can go to work, then you have to do something on the other end.
And I think that's been the concern about closing those what are non-essential businesses. First of all, you have to define what that is. And then secondly, you do have to allow for time for those kids to find another place to go. And that's been something that DeWine has been saying. He said the numbers of kids in daycares are dramatically dropping. He's trying to figure out how many of those kids are there because their parents are in the healthcare industry. And quite often, healthcare professionals are married to other healthcare professionals.
That's right. And I think the big thing is, and to repeat this, the governor's administration, DeWine's administration, has made it clear from the beginning that if they're going to make a decision, we will know about it. That's held true for the past couple of weeks, that whenever something's on the table, they let us know about it right away. So he's made it no secret that this is something that he's considering.
And he made it really clear at this press conference. It was some of the strongest language I heard from him and from Lieutenant Governor John Husted, that if anybody's misbehaving along with the directives that he's given so far about staying home, helping people work from home, he's very concerned about that.
Yeah, and you kind of heard Lieutenant Governor John Husted have that football coach vibe at the end too. Like you gotta shape up at this point. You don't want to be the person fighting over toilet paper in the grocery aisle. You want to be the person who helps other people throughout this whole thing. And I think we're going to continue to see more of this, where we have all sorts of people grappling with all sorts of decisions. And then one of the other big things is that just their everyday lives have been upended, and there's no answer as to how long this is going to keep going into place. So you're hearing from Governor DeWine, hey, businesses who are not adhering to these rules, you got to cut it out. You're hearing from Lieutenant Governor John Husted, all those out there who are, buying up all the toilet paper and not making this world a better place, you got to cut it out. And I think this is just a message that we're going to hear over and over again throughout the foreseeable future.
And this is the tweet that came out, and it echoed what Governor DeWine was saying during the press conference. Let me make it clear, I will err on the side of protecting people. The bad behavior, the reckless behavior must stop. And he's definitely calling out businesses. And we reporters are hearing from people all the time saying that they feel that they're worried about going to work. They don't feel that they are getting the proper protection at work, and that they're waiting for an order to shut down, because otherwise they feel like if they don't go to work, they won't get paid, and they're very concerned.
Yeah, it's kind of shining a light on a workplace dynamic that we've heard about for years and years now, this idea of, do employees have the rights, or do they feel like they have their own liberties when it comes to making these types of decisions, or does it have to be on the employers to set up the right kind of workplace? People who are afraid to voice their opinions on if the workplace is safe or not, out of fear that they might be fired because of it. We're hearing that all over the place. And then you're also hearing from employers who are saying, look, they're stuck in an impossible decision. They want to keep their employees safe, but they also want to keep their business afloat. And so for them to have to make the decision on their own to shut down or not basically becomes impossible. And we're also hearing just from emails on Twitter and social media, this idea of kind of wanting the governor to take it out of their hands. So there's just all sorts of differing viewpoints when it comes to closing these businesses going forward. And we saw that with the restaurants and bars. We heard from several people, hey, it's a tough call, but it's the right decision. There are other people who are very upset. This is their livelihood, this is their business, and it's a shot to the stomach to them.
And the governor has taken it out of their hands by ordering closures of barbers, hair salons, nail salons, spas and tattoo parlors, all sorts of fitness centers and bowling alleys and public rec centers, indoor water parks, trampoline parks, these sorts of entertainment options that I think some people were seeking out because the schools have been closed. But we have to not treat this like it's a snow day. This is a shelter at home kind of a situation here. But the bars and restaurants, we're starting to see now the impact of it going to just carry out only in restaurants, a lot of people just aren't exercising that option. We're seeing restaurants around the state laying people off, closing their doors, even though carry out is still an option.
That's right. And it's obviously a huge punch to the revenue to take that away, to take away the dining option. You're seeing some businesses, and I've been going around to businesses here in Columbus just to talk to them about what they're seeing, and you're hearing some businesses who say, you know, for whatever reason, their model works for this, where like if you're a pizza shop, then people are used to carrying out pizza, so it's okay. But for other places where it's more of a dine-in situation where you want to grab a drink or two, it's not working out as well for them. So you're just hearing all sorts of different comments when it comes to that. And in the end, we're all just waiting to see what happens, basically. And this, you know, it's hard for us as journalists, it's hard for people out there at home watching and listening. This idea of nothing is concrete at this point, that everything is going to be constantly evolving. For those who are new to following this situation, this has been something for 2 or 3 weeks now where we've seen the ball move every single day, and that's bound to continue down that path for a while.
Yeah, this is not a movie where you can fast forward to the post-credits scene.
Yeah, we have no idea.
We all have to live through this together. But there's always one moment at these press conferences where somebody will say, this will end. This is not a permanent reality. We don't know when it will end. We don't have any certainty on a date, but we're approaching, as Dr. Amy Acton says, that surge. We're climbing up the hill. We just want to make the hill lower and not have a big spike there.
Yeah, and that's kind of where I was getting at. I don't know if you were able to hear my question, but you know, for weeks now, the DeWine administration has been saying, take this seriously. And like we just said, they've heard from a lot of people who are still not taking it seriously. But on the flip end, there are people who are taking this very seriously, almost beginning to panic. So what kind of advice do they have? And what Dr. Acton said, what Governor DeWine said, is that if we're able to do the things that we need to do as a state, if we're able to follow the social distancing advice, follow the hand washing and sanitation advice, then we're able to, we're going to say it over and over again, flatten the curve to be able to delay the spread of this virus, to allow medical facilities, to allow doctors and nurses to be able to do the things they need to do. In the meantime, it is a very difficult situation to put a lot of people in, and it is becoming a strain on mental health. And we've heard from Lori Christ, the Director of Mental Health and Addiction Services, give advice and give hints on how people can sort of ride out the storm, because it is going to be a long time. And we'll say it here, and this is something that they said too. If you need to turn off the news, maybe you need to turn off the news. If you need to get the information you need, but then disconnect for a little bit and maybe not be on Twitter 24/7, I'm having problems with that too.
Same.
Then maybe you need to do that, and then just try to find a good habit to get into in the meantime, because this is going to be a long ride. We can all do this together, and there's a lot of advice out there. And we should mention that the Department of Mental Health and Addiction Services does have a web page set up to be able, and if you go to coronavirus.ohio.gov, you can make your way there. There are services provided, and like what we talked about earlier, there's telehealth services that are available too.
Yeah, in fact, that was the governor's order yesterday, to expand access to telehealth to people who are receiving Medicaid. And it's not only medical health services, but also behavioral health services, not just with big video conferencing equipment, but even on a cell phone or a landline. So there are some options there, once again, to keep people from having to leave their homes and go to doctor's offices, emergency rooms, and other facilities, so that those healthcare workers can be reserved for the surge that's coming, and also the equipment that they use can be conserved as well.
Yeah, and again, it's just part of creating or getting rid of the limitations, getting rid of the regulations that we've seen. And we saw it with the BMVs. There are people who are like, I need to stay at home. I also need to drive to the grocery store, and my license is about to expire. We've seen the relaxing of those types of regulations where they're calling on the legislature to basically create a grace period so that you cannot get pulled over for expired tags. They're asking law enforcement to not pull people over for expired tags. That's just one of many instances we're seeing around the state of trying to relieve a little bit of the stress that's out there.
And actually, the city of Columbus has already said that its police officers will not ticket people who have expired licenses during this time period, because it is a pretty extraordinary one. But asking asking lawmakers to do that. Lawmakers have a lot on their plates when they come back next week. They're supposed to meet. There's still a question of, the governor says that his order banning gatherings of more than 50 people does not apply to the legislature with 99 members of the House and 33 members of the Senate. But there's a lot that they're going to have to consider in a fairly short period of time.
Yeah, and the primary is something that could happen. He alluded to that during the press conference too. You've got what he called dual tracks to sort of solidifying the primary delay decision. One is in the Supreme Court right now, and one could be taken up by the legislature. Issues with BMV and being pulled over for expired licenses, that's something. And another thing that's still on everybody's radar is school testing, the idea of standardized testing and what the legislature should do in regards to students who are right now taking classes through distance learning. But, you know, there are teachers out there who are like, well, hold on, we have tests coming up. How are we going to administer these tests? Is it fair to administer these tests? We don't know exactly what the solution is. We don't know exactly what the legislation would be. The message from the governor has been from the beginning that neither he nor the legislature would allow a huge amount of students just to sort of fall off the edge of a cliff without some sort of net. And so he's saying that they're taking a look at that very closely and they're trying to make preparations for that.
Right, and there was a little bit of conversation in this about testing and distance learning. Some schools are doing it well. They have the capability. Some schools are having trouble moving it up. But we are being seen and heard on Ohio's public radio and public television stations. Some of them have resources on their websites that specifically relate to how kids can learn at home and to help kids learn at home. And so I'd encourage people to look at their Ohio public radio and public television stations' websites to see if some of those resources are available in their area. So before we wrap up here, one of the other things that we were talking about at the press conference is the huge number of unemployment filings. It's gone from, the week of March 8th to March 12th, 562. This week, 139,468. That shows the real impact of the closing of bars and restaurants and some of these other things. It's a huge, huge hit.
It's baffling, and it's an altogether sad, the situation that everybody's in. Lieutenant Governor John Husted has sort of been spearheading the idea of unemployment compensation, and he's been saying that if you are filing for an unemployment compensation or if you have a question, that going through the website is the best way to do it. In all honesty, the reports that we're hearing from viewers, from listeners, from people, it's that the phone lines are not working. If you try to call a number, whether it's for information about coronavirus, whether it's for any sort of other services from the state, the call centers are not working as well as the online tools that have been provided. So Lieutenant Governor John Husted has said, go to the unemployment compensation website. There are a lot of requests to be filed, and there's a huge question in the air just how much this fund can take. We already know that it is not solvent. We already know that there were questions of its solvency if another recession were to come. So a lot of questions up in the air when it comes to unemployment compensation.
And you mentioned that website, unemployment.ohio.gov. And you asked the question the other day about the Rainy Day Fund, which has $2.7 billion in it. The Unemployment Compensation Fund has a little over $1 billion in it. That's a lot of money, but we may potentially need a lot of money when these are the numbers right now. Not even the numbers going forward, but the numbers right now.
And the problem is this is just one area of several areas that we might need money. We as a state might need money in. So the governor has said he knows that the Rainy Day Fund is there. He's very aware that it is raining right now. So it is a fund that he's ready and willing to dip into. But where do you put that money? Where does it go? Does it go to unemployment compensation? Can you put it into unemployment compensation? Or does it go to one of the many, many other areas that are struggling right now because of all the disruptions with coronavirus?
Yeah, can you use it to buy medical supplies if they're available, to hire more healthcare workers? There's a lot of things going on here with that money and a lot of questions we have. As we end this broadcast, you'll be here tomorrow then, I guess, or one of us will be. Anything that you're expecting for tomorrow?
No, just basically an update. I imagine that I think they were saying that they're investigating more deaths. They're investigating sort of a cluster of cases in certain areas. So I think what they're going to try to do is sort of update people. They've been seeing this press conference as something that to really sort of shed light onto everything and sort of take the guesswork out of it. So I think that they want to continue with that messaging going forward.
And today I noticed that the governor was a little bit more spaced out. Things have been a little bit more spaced out. And if you were watching on Facebook Live or Ohio Public public television stations. You saw the interpreters were actually in this room here
we're
with
sharing
us,
space with them.
and they were in picture-in-picture to try to once again practice that separation and keep the number of people who are close together, keep them as far apart as possible.
I'm all for it. Every time I come to this desk, I wipe down this desk. We have hand sanitizer. We're doing everything we can here. Again, we're here so we can provide information to everything, but we too are practicing as much social distance as possible and all those cleaning habits that we need to do.
Exactly. All right. Well, Andy, I will talk to you then again tomorrow. Before we go, let's put up that slide one more time of the latest numbers that we know right now. We have 169 confirmed coronavirus cases. That's in 28 Ohio counties. 69 of those cases involve females. 100 involve males. There has been one death. Mark Wagner Sr., he's the father of former State Senator Mark Wagner, who is the chair of the Lucas County Republican Party. Sympathies out to his family. 39 hospitalizations, many of those in ICU. Illness onset February 7th to March 18th. So that's how far back this goes. And the patient age range, this time we have a newborn or an infant 1 year old to 91 years old, a median age of 49 years old. So that's the spread right now as we know it on coronavirus in Ohio. 169 cases. Again, as Dr. Amy Acton says, we are moving up. And that concludes our live coverage of Governor Mike DeWine's daily update on coronavirus in Ohio. I'm Karen Kassler. Thanks very much for tuning in and have a good evening.
You are watching the Ohio Channel. Any duplication, retransmission, or other use of any portion of this service without the express written consent of the Ohio Channel is strictly prohibited.
It took me between 2001 and 2003, so basically 3 years, to bring this research together. I called people